Good day, everyone. Today we will have our synchronous online classes on nursing pharmacology. Each one of you have experienced how you have taken medications in times that you experience concerns with your health conditions. There could be also instances that you have administered medications in some of your family members or relative of which they may need assistance on administration of drugs or medication. We have to consider every time that we administer drugs or medication is basically a priority when it comes to our responsibility. Our core responsibility and function is to promote safety. Patient safety as a core responsibility will entail the basic acquisition of the knowledge, the skills, and even the values. Those three areas, which is the SKA, are very significant for every nurses who will take part their responsibilities. Even as nursing students, you can basically consider how you will discharge your responsibilities even though you are not yet licensed. However, at this time, you have limitations on the perspective of this role because again, administration of medication entails with the functions of a licensed nurse. But again, with the knowledge that you may have with over-the-counter drugs, which may facilitate also administration on a perspective that anyone could definitely purchase over-the-counter drugs, you may take part on those responsibilities even though you are not yet licensed. There are situations as well that at this time, you have been oriented with the fundamentals of nursing. Those basic skills that have been oriented to you in the fundamentals of nursing, health education, health assessment are very important foundation on how you will understand responsibilities in pharmacology. Number two is the basic foundation on how you will consider basically on the concepts of biochemistry, microbiology, human anatomy, and physiology. This is the time in your second year level that you will be exposed in your clinical and part of your responsibilities and immersion in your clinical, such as the related learning experience, is administration of drugs. As what we have reiterated, most of you for sure have experienced have experienced those medication administration. Even you're the one who administer or you're the one who received those medications. Just recently, we have experienced the 2-year pandemic, and one of the responsibilities and issues that we have faced is basically on the administration of the COVID-19 vaccines. Those are experiences or live experiences by which it will consider many principles on the perspective of how you will convince everyone to take the COVID-19 vaccine. So with those experiences like at the time that you have heard about medications or rather the COVID-19 vaccine, you are not convinced even you are not convinced if ever there are no scientific basis. You are not even convinced if ever there are studies already consider consider that there are no adverse reactions that persons who may receive those vaccines may not risk their health concerns. So in the past 2 years, almost most of the majority of the population of our country, our Filipinos and the public, have received those vaccines. And simply because it's basically based from the scientific studies and it is well explained and health education matters of convincing and entrusting those responsibilities to our health workers. And nurses have the major responsibilities of giving those health education and why our people have been convinced to take the COVID-19 vaccine. So even apply it to yourselves. What are those questions that even arise during the time that you are being convinced to take the COVID-19? The social media, health workers, information dissemination are those means that you have observed in those situations while the government is promoting the COVID-19 vaccine. Indeed, I know that there are hanging questions that arise during those times. Will it be safe? Will it be effective? Will this vaccine really will consider protection? Or there are some misinformation that really arise those time that these are depending on the various brands of vaccines. Those are normal inquiries during those time. And what will be the role of nurses? The role of nurses is basically to uh, give health education through the basic concepts in pharmacology. Now, with those experiences and lived experiences, there are situations that you really need to take part prior to the administration of drugs. Just like why it is important to take the vital signs of those patients before receiving medications. Just like an example is antihypertensive drugs. If the patient is taking a maintenance drug, such as antihypertensive drug, obviously we are talking about hypertension. And what is hypertension? Colloquially, it could be or defined as high blood pressure. So meaning, if you go back to the anatomy and physiology, we're talking about basic functions of the heart. And deviations in the basic function of the heart contributes to the problem with hypertension. Now, what could be the role of nurse in the administration of drugs? You must take into consideration the patient history, why the client is taking antihypertensive drugs. And basically, it's what I have reiterated. Vital signs are very important because antihypertensive drugs are given to our clients to basically control problem with hypertension or high blood pressure. Now, if you will not if you will not assess the patients on the vital signs, if ever the patient experience hypotension, there could be possibility that a patient who's taking antihypertensive may be triggered with hypotension. And I think and you must really be careful in administration of drugs without the vital signs, because if ever the patient have low blood pressure, then this may trigger to a problem with hypotension. So I think it may trigger to a problem with complication, possibility of adverse reactions, and possibility that the patient may risk to a life-threatening condition. So taking or giving medications are serious responsibilities. Now, again, for example, if you will be giving a drug to a patient experiencing palpitations, and what are palpitations? Palpitations are those that are reactions of the heart whenever patients may have uncontrollable release of adrenaline from the adrenal glands. And adrenaline are hormones that will facilitate vigorous contraction of the heart. The vigorous contraction of the heart may cause the possibility of increased oxygen demand. And increased oxygen demand may cause the possibility of decreased blood supply to the muscles of the heart. So eventually this may cause a possibility of complications. So when when you are about when you're about to think that in those situations that physiologically the patient will experience those problems, then the doctor may possibly prescribe those drugs ending in olol. What are those olol? Metropolol, atenolol, propanolol. So you don't need to memorize all those medications. All we have to do is to consider suffixes under those common classification of drugs. So going back to the prescription of the doctor of olols, olols are considered as beta blockers. From the term itself, block and beta. The beta is considered as a receptor. It's an impulse transmission, electrical transmission to give signal to the heart to contract. So that's why whenever there are normal mechanisms that the adrenal glands will release adrenaline, then it will cause the vigorous contraction of the heart through the signal of beta receptor. So if the patient experiences palpitation, the doctor will facilitate to have prescription of beta blockers so that to block the beta 1 and may facilitate stabilize rather contraction of the heart so that it may lead not to oxygen demand and possible complications to the heart. Now, you are assuming, not assuming, claim it that you are now registered nurses and you will administer these drugs. You all know that the olols or beta blockers will slow the heart rate. If you will make if you will not assess the patient and basically take the vital signs, this may have an implication to the condition of the patient to develop possible complications. To what extent? If this drug will basically consider slow heart rate, then I think you need to check heart rate. Okay? You need to check heart rate because if ever the patient is having below normal heart rate and you will administer olols or beta blockers, do you think it may cause the possibility of complication that it will slower than normal the heart rate? That could be possible. And that term is what we call bradycardia. If it will not control the continuous slowing of the heart rate, then this may cause the possibility that it already reached toxicity. And once it reached the toxicity, that will cause the possibility of complication. Possibly, the patient may lead to cardiac arrest. So, with those rationalization that I have mentioned, the major responsibilities of nurses are definitely depending on what you have acquired on the principles of pharmacology. This will take place when you are about to discharge your responsibilities when administering the drug. It is not just only the responsibilities of the nurse, but basically you will also need to promote independence to the patient for them to become confident so that they can manage their own situations when taking medications. They can already be alert when there are already adverse reactions, and they could be also be capable of attending emergency situations whenever they encounter adverse reactions of drugs. Those are situations, overviews by which nurses uh, may need confidence in the administration of drugs. We may be knowledgeable, but competencies will be complete if you are skilled and you have the right values or appropriate attitude that you will consider in the administration of drugs. Another situation, for example, when you encounter situations that our patient is experiencing vomiting. So first and foremost, will you consider primarily giving an anti-vomiting drug? At first, it must not. You have been oriented with the nursing responsibilities of a nurse: independent, dependent, and collaborative. We are considered as professionals because most of the time we administer and perform procedures independently. The dependent could be whenever you will consider collaboration with other healthcare team. So there must be an agreed base care. So that's why if you will notice most of the interventions that have been considered for dependent function are medications. Somehow your independent function will focus on non-pharmacological management. So with the evolving trends of roles of nurses, even medications in other countries allow nurses to do prescription because of the extent of implementation of universal healthcare. So sooner or later, it may also exist. It may also implement here in the Philippines. And I think in the next few years, and once you will become licensed, I think this could be in place. on how the nurses will expand the role when it comes to medication prescription. So you need to be more serious on this. Basic role in the administration of drug entails safety of our patients. As go back to the situation of patients who are having or experiencing vomiting. A patient who may commit vomiting may possibly consider gastrointestinal upset, vomiting that is caused by hormonal, if the patient possibly is may be probable to be pregnant, or those situations that triggers possibility of threatening conditions such as poisoning or toxic effect of drugs. There are many factors to consider. That's why assessment is very important. So that's why one of the considerations that we will take seriously in pharmacology is on the perspective of why we need to assess the client prior to the administration of drugs. If the patient experiences vomiting and you have assessed that the patient basically had been identified with the the food intake that he had, so will you consider to give primarily anti-vomiting drug? Not yet. The body is responding on the perspective of vomiting so that to remove the toxins. And that is a normal compensatory mechanism. The monitoring of the nurse is basically when the patient vomits, that could be risk for fluid losses, right? If the patient experiences fluid losses, then that may entail possibility that the patient could be leading to dehydration. So that's why the nurse is responsible for the hydration status. Other than that, you will ask the patient if the patient took any medication, and that will translate to your knowledge that if it is related to drugs, then we need to take into consideration emergency measures. So those are responsibilities that we take. For example, if the patient is experiencing diarrhea or loose bowel, most of you, I know you will definitely agree with me. Most of you will look for a drug, diatabs, loperamide, for you to basically control the loose bowel, because basically you consider if it is only for convenience. But again, if any toxins infection are identified physiologically or diagnosed, the body will respond to loose bowel or excretion through stool on the toxins, by which the body is considering it as a normal compensatory mechanism. So let's go back to the situation of vomiting. If the patient experiences vomiting, then we need to consider the monitoring of hydration status. Then at the time that it will continue and the patient will be dehydrated, the focus will consider now on hydration status. So that's why the anti-motility drugs such as the diatabs and loperamide may consider if in the situation it is needed. So that's why it is not always a primary interventions, because the nurse responsibility is to monitor and assess primarily the patient before giving any medications. And those medications may probably need culture and sensitivity tests, may probably need results of diagnostic examinations. Those are the basis, the scientific references of why medications are being given if the body is not anymore responding to normal compensatory mechanism. Okay? So these are overviews of what we have in nursing pharmacology. Now we will watch a video presentation that will entail and will inspire you. Why do we need to be more confident? Why do we need to be more competent in terms of your discharge of responsibilities in the nursing pharmacology?
No one should be harmed in healthcare. Yet, every minute, 5 patients die because of unsafe care. These deaths can be prevented. Simple commitments can ensure safe care.
I commit to updating my knowledge and skills regularly to provide safe care for my patients.
I commit to being actively involved in my own care.
I commit to giving the right medication to the right patient, in the right dose and through the right route, at the right time.
We commit to working together as one team, open and transparent.
I commit to explaining to my patients how to use their medication correctly.
I commit to using the required procedures for each delivery I perform.
I commit to establishing a culture of patient safety.
Together, we can save lives. Let's commit to ensuring safety in healthcare. Speak up for patient safety.
Okay. Every September, we are celebrating the World Patient Safety Day. And this month, we are definitely celebrating patient safety, and one of which, based from studies that patients, rather nurses and other healthcare workers have identified according to survey that most of the findings in the errors committed by nurses are medication errors. Indeed, this must be prevented in a way that, since our core responsibility is on patient safety, then we need to take part on this promotion, on how we will be more uh, competent in the discharge of these responsibilities. Now, your commitment of giving the right medication, on the commitment of monitoring the patient, on the commitment that the possibility of development of complication must be prevented, and this could be discharged accordingly with the advocacy of patient safety. Sooner or later, I'll be presenting to you how or what are those concepts of patient safety that are related to medication administration. But for now, again, I'm opening the floor. If there are questions, inquiries, the chat box are open. Please send those questions or inquiries in the chat box. If there are concerns with the audio or concerns with the presentation, queries as well, the chat box are open so that we could adjust, particularly in the delivery of our lesson for today. But for now, what are to be expected in the uh, course of the nursing pharmacology? The NPH 000 as the course code, and or pharmacology as the course title. We are using nursing pharmacology for us to have more focus on our responsibilities in pharmacology. In the introduction of the concepts and principles of pharmacology, each student are expected to have the learning outcomes. And those learning outcomes are, at the end of the topic, given relevant, actual, or simulated situations or conditions, the students will be able to explain the meaning of pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. Okay, when we talk about this is dealing obviously with medications or drugs. And these terms, such as pharmacotherapeutics, pharmacokinetics, and pharmacodynamics, are the basic knowledge and principles that are being used in general in pharmacology. Let's have first the overview of what pharmacotherapeutics is. If we're talking about therapeutic, you can post in the chat box, what does it mean? What do you mean by therapeutic? You can post in the chat box if uh, have you encountered the word therapeutic? What do we mean by therapeutic? So that we could connect this of what do we mean by pharmacotherapeutics. The chat box is open for you to type those terms that possibly pop in your mind of what therapeutic means? So we'll wait in the chat box. So we are seeing response in the chat box. We have treatment, beneficial. Those answers are healing, correct? Any other terms that could be associated with therapeutic? Treatment, beneficial, healing. Actually, actually, to those terms that you have posted in the chat box really matches with what we meant by therapeutic. Curing, okay, that's good. So for those students who have participated, thank you very much because your answers are definitely correct. Because if we're talking about therapeutic, we're talking about drugs that are intended for treatment, drugs and its desired effect, drugs that will facilitate cure, okay? Drugs that will lead basically to its maximum effect. So one of the questions that are being raised whenever you are administering the drug is, or our basic question, what is the drug for? And definitely you will not just respond. This is for your recovery. This is basically drug orders from doctors. This is a treatment regimen from the hospital of previous cases. Drugs are being administered for you to get well. If these are your responses, can you establish the trust with your patients as well? Let's have the opposite situation when you are the patient and you will receive those responses. Probably rapport may not be established because you need to be convinced anything that comes into your body, you're also taking part on how you will be safe in every procedures that you will involve yourselves, and one of which is medication administration. So that's why if we talk about pharmacotherapeutics, we're talking about desired effect, maximum effect of the drug, the indication of the drug, the desired effect of the drug, what drug it's what is the purpose of taking the drug. So these are the questions and the definition that will best describe pharmacotherapeutics. Let's go now to pharmacokinetics. Pharmaco obviously is all about medications. But if we talk about kinetics, I know you have encountered these terms in some of your courses. Can you type in the chat box if it pop into your mind or if ever you have encountered what could be kinetics? If we talk about kinetics, what does it mean? Okay, if we talk about kinetics, there are already answers. Movement, motion. Good. These are the terms that we expect when we talk about pharmacokinetics. It means that if we talk about kinetics, it's the movement of drug. At the time that you have taken the drug, the time that it has been absorbed, and at the time that it has been excreted. That is basically the movement. Not all 100% of the drugs that you are taking will be absorbed by the body because just like for example, if you're taking multivitamins, not all the vitamins that are composed as part of the composition of the drug may be needed by your body. Our body have also reserved vitamins. And that may cause the possibility that for the body to attain equilibrium, the liver and the kidneys will basically take part. The liver will take part in detoxification, and the kidneys will definitely take part on excretion. And in that way, that will facilitate balance. And if it will not reach the balance, the possibility is it may reach the possible toxicity. And toxic effect is considered as a serious adverse reaction of the drugs. Actually, adverse reactions these are unintended and untoward reactions of drugs. That's why every time that you are being told, please report any adverse reactions, why you are being asked to report, because adverse reactions may possibly lead to a possible complication, and serious adverse reactions may lead to toxic effect of drugs, and serious toxic effect of the drugs may lead to a possible fatality. So these are very important. All you have to do as a basic knowledge in pharmacokinetics, remember the ADME, or what we call ADME. What do you mean by ADME? A, absorption; D, distribution; M, metabolism; and E, excretion. Later on, we'll discuss further of what absorption, distribution, metabolism, or excretion is all about. Because these are primarily the four stages of pharmacokinetics. At the time that has been absorbed and at the time that it ends with excretion. Just like, for example, you have been oriented about the routes of administration of drugs. Just like, for example, if the drug had been administered through oral, okay, per orem, then if drugs will follow through absorption, it will start with the oral cavity or mouth. It follows through that it will proceed to stomach, and after proceed to the stomach, it will proceed to the GUT, the intestinal tract. Then once it proceed to absorption in the intestinal tract, then that's the time that the liver will facilitate detoxification. After facilitating the detoxification, that already considers absorption. And it is distribution when the drug reaches the plasma. And what is plasma? Plasma, basically considered as part of the blood. The plasma is responsible for transporting nutrients and other chemicals to the body, including the chemical properties of drugs, so that it will attain its distribution. So ibig sabihin, when we talk about when we talk about absorption, at the time that you have the intake of the drug until it reached the plasma. And once it reaches the plasma, that's the time that it will be distributed to the body. And once distributed to the body, it will now facilitate the what we call metabolism, so that the cells will consider its target organ. Then once it consider the target organ, then it must reach basically the correct amount, the correct volume, and properties of drugs that must reach the target organ. If to prevent the toxicity, then as what we have mentioned, the liver and the kidneys will take the part of excretion, so that it will eliminate or excrete as a product of metabolism those drugs that may not be beneficial to the body. So that's why it is very important. So a question comes in that, sir, do you mean in pharmacokinetics, if individuals have problem with kidneys and have problems with liver, will that hinder the function or the principle of pharmacokinetics? The answer is yes. So that's why it has been very important that when you consider drug administration, very basic, very basic, assess the patient's status of kidneys and liver, because most of the drugs are hepatotoxic, which is liver, that can cause damage to liver, and some may cause nephrotoxic. And if identified that patients have risk in medication administration, then doctors will be notified and possibly consider or prescribe drugs that are less nephrotoxic or less hepatotoxic. In our discussion, we will basically identify those drugs that are hepatotoxic and nephrotoxic, so that we will be more careful. Moreover, this is more important when you're administering drugs to pregnant clients. So you have now your OB course, or obstetrics, maternal nursing, maternal and child nursing, which drugs will really take part in the process from the consultation period of the pregnant mother until she delivered, and postpartum. Medication and drugs will be part of the process. So that's why nurses will take into consideration what pharmacokinetics is. Okay? Next, how about pharmacodynamics? So if we say pharmacodynamics, again, we have considered pharmaco as drugs. So when we talk about dynamics, what comes to your mind? what do you mean by dynamics? Dynamics. If we talk about dynamics, now we have received answers. If we have dynamics, process, good. Effects, action, those answers. Thank you so much for those who are participating with our questions, because your responses and answers are correct. If we talk about the process, meaning if we talk about the dynamics, this is on how the drug, this answer definitely the how the drug is taking, is reacting to the body. That's why, what's the difference? What's the difference between side effect and adverse effect? Side effect and adverse reactions. If we talk about side effect, these are the expected, okay, expected physiologic response or biochemical reactions of the body. So expected mo, for example, when a patient is taking antihypertensive drugs and the patient experiences headache, definitely you must identify if it is already adverse reaction or side effect. Just like, can you give me, sir, an example? An example is when the patient is taking uh what drug? Okay, antihypertensive drug, vasodilators. Okay, vaso meaning blood vessel, dilate to open blood vessels. One example is nitroglycerin. One of the side effect of nitroglycerin is headache. The next question is that of, if the question will ask you why I am experiencing headache, what will be your response? Your response could be if it is side effect. The next question is how you will explain to the patient that it's definitely side effect. So, ma'am, this how it goes. So, ayan na. Pumapasok na kayo dun sa mechanism of action. If you're trying to explain how the drug is, how the drug, pag sinabi mo ng side effect to, pharmacodynamics na. And further, if you explain how the drug is taking effect to the body physiologically through the knowledge in your anatomy and physiology, you are now giving the information on pharmacodynamics. That's why in pharmacodynamics, this best explains the physiologic changes and the biochemical reactions. If we talk about reactions, we are talking about pharmacodynamics. So let's go back to the situation. The situation goes that your patient is taking vasodilator, blood vessel, dilator, opening. So on that note, when the patient asks why I am experiencing headache, ma'am, that is side effect. The next question is how you will further explain that headache is considered as a side effect. Ma'am, when the drug enters your body, the action of the drug is to dilate the blood vessel. And to help dilation of the blood vessel, need po ng mga nerves natin na mag-transmit ng signal, transmit signal. And once it transmits signal, the nerves are working to keep all of our blood vessels dilate and open. And with this reaction and stimulation with the nerves, it may also create temporarily nerve tension. That nerve tension may also possibly consider that the nerve or electrical charges will basically affect the process and may lead to temporary headache. The temporary headache is a result of the impulse transmissions that will cause the opening po ng mga ugat ninyo. So, ma'am, if your headache will still continue after 4 hours, 8 hours, please report to me. Kasi that's the time that is now considered as adverse reactions. Kaya in our perception, when you experience or when you consider adverse reactions, 'di ba, that's the time that the doctor will discontinue the drug and prescribe a new drug. So the patient will be under observation with those drugs. If the patient experiences the same situation of longer period of headache, then again change the drug again that may have similar actions. So that's why that is one way of how the nurse will take part on it. Kasi you really need to take into consideration if the situation is already adverse reactions. Another example. Another example is that of there are situation, yeah, all of you, the 36 students who are here have been vaccinated already, and why you are being instructed at the end or after vaccination, you need to stay in the observation area. You need to stay in the observation area for you to report if there are situations that you have developed fever, if you are experiencing any untoward, okay, untoward signs or symptoms. Because if ever there will be untoward signs of symptoms, that should be reported to, for example, you have taken a brand of Pfizer, you have taken Sinovac, Moderna, any brand, this will be documented and be reported. If other individuals also have experienced the same situation during those time, probably you will report fever. And that's why every time that you will have vaccination, standby po ang paracetamol. So, what will be the role of the what will be the role of the nurse in health education? Kasi baka isipin, definitely ay isipin, they will think, oh, why I experience fever? Remember, not all individuals have the same response to tissue damage or injury. Kasi nag-ano ka eh, introduce ka ng needle. If you introduce the needle, there is a tissue damage. Pag nag-cause ng tissue damage, it will cause a possibility of release of histamine. And that histamine is the one that you are observing that causes the redness. And if it nag-cause siya ng redness, the histamine will trigger the synthesis of prostaglandin. The prostaglandin is the one that will transmit impulse to the pain center at magre-response siya ng pain. Other than pain, magre-response din yan ng warmth, and that will cause a change in the temperature and possibly cause fever. So, if if this situation goes, kailangan pa rin siyang i-monitor. But eventually, the nurse must monitor because possible na tong adverse reaction, because it's not common eh. It's not common na immediately nagko-develop agad ng fever in 5 minutes or in 10 minutes. So the patient will be advised possibly of taking paracetamol. And if ever it's not managed by paracetamol and it caused already the swelling on the site, this is definitely unusual. So those are adverse reactions. So the nurse can still be mentioning, can still mention po ba that these are side effects? It's not anymore. It's already adverse reactions. So that's why that is the time na pag sinabi mong why the patient experiences fever, ma'am, kasi ganito po yon. Once the needle introduced into the skin and it reduce already po yung drug, nagkakaroon po yan ng tissue injury. But again, as a normal reaction of the body, maghi-heal din po yan. But eventually, because of the tissue injury, the normal response of the body, nagre-release po ng histamine, at sa nerve po, magta-transmit ito ng signal to with the prostaglandin po synthesis sa brain, sa pain center. Kaya po tayo aware na nagko-cause po ng pain. So, that's why it's either, ang maging response po is either pain or fever. That's why paracetamol po will possibly be prescribed by the doctor so that to manage it. But again, this could be a normal process. But if it is prolonged and eventually the frequency of fever and the frequency of swelling lead to a complex situation, it took 1 day or 2 days and it caused the swelling, please report it to us. Then you are now talking about adverse reactions. So these are the things that we're talking about in pharmacodynamics. If we're talking about how drugs, okay, how the drug starts its absorption from the time you take the drug, how it enters the body, how it was excreted, its pharmacokinetics. But if we're talking about that the patient, we are talking about now the the adverse reactions, side effects, because these are evidences how the drug is reacting to the body. That is pharmacodynamics. And the pharmacotherapeutics are very evident if the patient, for example, at time that the patient admitted in the hospital have results of increased WBC, that's an indication of infection. And after the patient completed the drug, and it's already very evident that it decreased the WBC, so meaning it already resolved infection. So it means it attained to its desired effect. That's pharmacotherapeutics. Again, if there are questions related to this will be discussed further in our next slide. Next po, Next is pertaining to the what we call toxic effect. So ano po ba yung toxic effect? When we talk about toxic effects of the drugs, for just like in a relationship lang yan. If it's already toxic, meaning it's not anymore healthy. Okay? So if it's already toxic yung drugs, meaning your body is not anymore in balance. Your body is not anymore compensating to prevent continuous and possible complication or risk. So that's why we need to be alarmed on this. If, for example, a simple toxic effect, if the patient is on overdose, that may really consider toxic effect. And what could be the toxic effect? As what I've told you, the two major organs that could be affected are the kidneys and the liver. So probably this could lead to the possible liver damage and kidney damage. So if ever the patient will respond to you and will open to you unusual. So definitely definitely pwedeng adverse reactions lang 'yon. Pero do you know that uh, toxic toxic level of drugs can be detected through serum tests, through blood tests. If the patient is suspecting for toxic effect, the patient's serum will be tested on the level of the drug. At meron tayong tinatawag na therapeutic level at toxic level. So pag nag-reach sa result po yung toxic level, the nurse must be aware of how to counteract the toxic effect. And that is what we call letter A. You can type in the chat box, what is that? What is the drugs that counteract toxic effect? It starts with letter A. Again, what are those drugs that will counteract toxic effect? You can type in the chat box, what are those drugs? It starts with letter A. Okay, very good. Ibig sabihin ng neurotransmitters, I'd like to acknowledge the first answer. Okay, Mr. Mangalili answered already antidote. How about the others who can share also answers? What are those drugs that counteract toxic effect? It starts with letter A. Okay, I may also expect other responses as well. Okay, you may have antibiotic. Okay, that could be. Okay, so what could be that A that I'm talking about to facilitate the to facilitate counteraction to toxic effects. Actually, your first answer, Mr. Mangalili, is correct. Antidote. But again, antibiotic could be considered as one of the antidote. Okay? But in general, the drug that really counteract toxic effect is antidote. So, antibiotic could be one antidote. Could be one of the antidotes. But in general, the drug that counteract to toxic effects are antidotes. That's why very basic in pharmacology that you need to consider drugs that will counteract. Example, one of the example that I mentioned to you a while ago is when the patient is taking Olol. Okay? So Olol, beta blockers. So ang sabi ko, we need to monitor vital signs. If, for example, the patient's vital sign is bradycardia already, but still, the drug had been administered to patient and continuously nag-slow yung heart rate. So, posibleng mag-lead yung sa patient ng shock and possible cardiac arrest. So, ang purpose natin to counteract the toxic effect of the drug kasi it's already toxic effect kasi continuously nag-slow yung heart rate. So, we need an antidote. We need definitely an antidote to counteract the continuous lowering of the heart rate kasi posibleng mag-lead sa cardiac arrest. Pag hindi yon na definitely na counteract, magka-cardiac arrest ang pasyente. So now we need an antidote. So the patient will be given epinephrine. And the epinephrine is the one which is an adrenergic drug that will increase heart rate and possibly stabilize its heart contraction or heart rate. So yun, you need to be aware and be alarmed of that. Kaya anyway, you need to consider any drugs that will cause toxicity nurses must be aware of its antidote. There are some situations that it's not just only overdosage. If the patient, for example, health condition, have reactions of adverse effect, tapos nag-lead agad siya into toxic effect because of certain degree na immediately the patient developed a certain complication. Tapos, uh, the drug has been given. So we need to control the complications as well. So kundi magde-develop yan into liver damage, kidney damage. So that is what we call toxic effect. Another knowledge that we need to consider in pharmacology, and aside from toxic effect, is the use of the nursing process. Um, we are aware of the nursing process as a systematic way on how you manage medication administration. So in nursing process, there are situations like nurses may not need to refer to doctor and depend on the doctor's decision when it comes to medication administration. For example, there are medications that are being administered continuously to the patient through side drip or piggyback. So, since you are assessing the patients continuously, just like going back to the going back tayo doon sa beta blocker na olol. If continuously bumababa yung heart rate ng pasyente, will you still wait for the doctor's order to discontinue the drug? Not anymore. It's an independent function of the nurse to already hold the drug because seemingly there are already findings that will lead to a possible complication. And what could be in the mindset of the patient? The mindset of rather the nurse is to prepare antidote. And if the doctor and the nurse agreed on the administration of the drug, then certainly this is to prevent complications. So in the nursing process, it is not just only at the start that you administer the drug, why you need to assess the patient and take the vital signs. Those patients who may have complex diagnosis, they need to be monitored continuously regardless if the patient is taking drugs or if the patient is taking medication. Because if the patient is taking continuous drip of the drug, the nurse must be aware when is the time to discontinue, when is the time to increase the regulation, and when is the time that there's a need to put on hold the drug. Not always or at all times. That once it was ordered by the doctor, you need to administer it. The nurse has this independent function to withhold the drug if ever suspecting that it may cause the possible complications or it may cause the possibility that the patient will experience adverse reactions. So again, it's considered as preventive measure. And nursing process has been part always in the administration of drug. Whenever you have your drug handbook, I advise you at this time that you purchase or borrow na drug handbook. Try to check the component of the drug handbook, nursing drug handbook. It always consider their nursing responsibilities. And part of the nursing responsibilities is to consider assessment, planning, intervention, and evaluation to the client simply because administration of drugs is a continuous process using the principle of nursing process. Next is we need to take into consideration as advocate. Now I have started with you the playing of the video which corresponds to the concept of safety. Now, when we talk about the concept, when we consider the concept of safety, we're considering the welfare of the patients and protection of nurses as well. So I know that it has already oriented with you the rights of medication, the rights of the right patient, the right dose, the right time, the right drug, the right frequency. These are rights that will guide our nurses that we are gearing towards advocacy of patient safety. Okay? So these are the expected learning outcomes throughout the nursing pharmacology course. Now, if you wish to open some of the studies, researches that you have read, updated references that you have read and suggest it to the class, we are very much open with it. If there are issues and trends that you have experiences that you want to share, again, this class in pharmacology and definitely, definitely will promote a continuous process of two-way process of sharing. I am a facilitator of learning, but in a way, I can also learn from all of you and from your experiences. To continue, again, the chat box if there are questions and inquiries. Next, every time that we do, every time that we have our interactive sessions, I may always ask you what could be in your mind. What does those words, terms that possibly best define pharmacology? Again, please visit the slido.com with the code 2224289. This is a word cloud and I encourage everyone to participate. Open the slido.com and enter the code. What could be the best what best define pharmacology? It could be in one word. So we will wait for your responses using the slido.com. 36 dynamic and active students who are participating in my class of the nursing pharmacology. We are now seeing medications. Let us see responses from the others. Among the other 36, actually, the results of our interactive sessions will be posted in our Neo LMS. It will identify those who have participated in the interactive sessions. And it is very much appreciated for those students who will participate. So we have one word that now appear in our interactive administration of medication. If we're talking about pharmacology, we're talking about drug, we're talking about medicine, medication. So please continue to indicate your responses because we will have a discussion on this. Treatment, it's all about drugs. So it means that the word that has been highlighted here with a bigger font uh, is the one that are common answers or responses of our students. Again, 36, hoping we could maximize those answers. 36 dynamic and active N24. We have treatment, we have drugs. Watsons. Watsons, are you referring to the ano? Oh, now if there's already Watson, there's already Mercury drug. The next thing that I will expect is the Generica drugstore. I will wait for those response. But anyway, so we have Watsons, we have the Mercury drugs, uh, pharmacology. Okay. Even during your childhood naman kasi even your parents will tell you, okay, purchase drugs in these outlets. And if you are seeing these facilities, and definitely you will it will pop into your mind and say it this definitely offers services on ano on drugs and medications. Okay? Botica, pharmacy. Okay? So we are now talking facilities, therapeutic. Okay. If you notice in your answers, most are referring to drugs. And very true. We are talking about drugs, we are talking about definitely medications. And with your answer as treatment, why we're giving those drugs. Actually, if there are discomforts, if there are discomforts or some of the manifestations that are being experienced by the patients, uh, we expect that the body will take balance. Kasi di ba, for example, if we experience pain, we must take immediately pain reliever. Eventually, it subside right? Yung degree of pain, yung level of pain nagsasubside siya because the body is still working. Now, if the body is not anymore working and already it considers a complex situation, then that's the time that the alternative way to mimic the action of the body's normal mechanism is to take the drug. So ibig sabihin drugs are always on the always on the plan B, optional, alternative. It will not always be the first unless on situations that will consider emergency. Kasi it's very obvious that in emergency situation, the body is on disequilibrium and not working on itself. So that's why drugs are the choice to consider on the treatment. So since the treatment, correct, because we are talking about pharmacotherapeutics, that is really the purpose of why we take medications. And if you will consider po in the labels of those drugs, or the packaging rather, it indicated there the indication of the drug. What do you mean the indication of the drug? The indication of the drug is the purpose of the drug. That's why there are some situations like why you're taking antibacterial. So obviously the indication are those types of infection. Okay? But there are only drugs that are only indicated for certain types of infection, kasi there are only drugs that are matched to inhibit the growth only on gram negative or on gram positive bacteria. That's why it's very important to consider not to have self-medication, because seemingly self-medication may cause the possibility of effect of the what we call antibacterial resistance. These are being promoted by the World Health Organization. Pag nag-self-medicate kayo, the problem is that of yung antibacterial resistance sooner or later, kasi kung for example, you suspect that you have infection and then you take the antibiotic is not taking into action to the body, kasi it's not we don't have any scientific evidences that this drug is the one that is appropriate for your condition. So what is now the body? The body will be immune with those drugs. And sooner or later, if it is supposedly be the one that will be supposedly prescribed to the patient, ang problem diyan 'pag nag-cause ng resistance, ibig sabihin the drug will not take its effect. Kaya there are some situations like na 'pag nag-cause na 'yan ng severe infection tapos nag-self-medicate kayo, yung tinatawag nating antibacterial resistance, ibig sabihin those antibacterial will not anymore take into effect sa body. Kaya be very careful with those self-medication, most specifically antibiotics, kasi we really need to prevent antibacterial resistance. So sa antibacterial resistance, nagle-less nila yung effectiveness of the drug. Nagiging less yung effectiveness. The other term for effectiveness is basically potency of the drug. So yun yung very important thing that we need to know. Other than that, we need to take into consideration when we talk about treatment, it's not for purposes of convenience. Ano yung purpose of convenience? If you experience pain, okay, take the pain reliever. If you experience agad fever, always take agad paracetamol. Let us always also consider the non-pharmacological management. We must not be dependent with drugs. Remember ha, always take this into consideration. Hindi ako galit ha. Take into this consideration. These drugs may damage kidneys and liver. Okay, bear that in mind. Kaya that's why we need to take into consideration non-pharmacological management. So if it is not anymore managed with the non-pharmacological, or it could be supported by both, then that's the time that the patient may take the pharmacological management such as those drugs. Alam niyo po ba, for example, ang paracetamol is hepatotoxic ang paracetamol. Pwedeng ma-damage ang liver if it is not taken on its appropriate dose. And somehow ang hirap din na if we will have dependence or reliance sa gamot, because again, we will not take anymore yung purpose. Example, sabi ko nga sa inyo, when the patient vomits, when the patient experiences diarrhea, probably all of you will think diatabs, all of you will think loperamide, pero the toxins are inside the body. Will it be helpful? Hindi. So that's why with the knowledge, we need to support yung hydration status, rather than that's the normal mechanism that the body is removing toxins out of the body. And in that sense, primarily, hindi agad iisipin ng loperamide. Kailangan ma-remove ng normal response ng body, yung bowel eh. So kailangan ma-excrete yung toxins. Pero kung pipigilan mo yan, ayan, it will remain. Lalo na pag nag-take kayo ng, okay, mapipigilan lang niya yung motility ha. Kaya anti-motility drugs ang diatabs at loperamide. Pinipigilan lang niya yung motility para hindi mag-cause ng passing of the stool. Pero the toxins itself, nandun pa rin sa loob ng body. So it may not be initially helpful. But I'm not saying that those drugs may not be helpful. It definitely be helpful. But on the purpose itself of removing the toxins, I think yun ang isa sa mga dapat nating pag-isipan. So, on that perspective, thank you for all your responses. Paano naman kung halimbawa at the convenience na na dependent ka na sa drug, hindi ka na nagko-consider, most relied ka na. These are situations naman na wala kang pain pero hinahanap mo na to take the drug. Ayun naman tawag doon drug abuse until mag-lead yan sa drug addiction. So ito na yung mga serious conditions by which there is a need for rehabilitation. Doon na tayo papasok sa rehabilitation. Sooner or later po, we are discussing already uh, I attended the Department of Health at ang Department of Health through their treatment and rehabilitation centers are working on a module on addiction nursing, and that is related to pharmacology. And we are aiming na our nursing students will be exposed to treatment and rehabilitation center kung paano how we will basically attend to patients who are undergoing the treatment and rehabilitation due to drug addiction. But mainly, meron din mga situations na mga substance abuse. So, sa substance abuse, it's still in the concept pa rin ng pharmacology. Kasi patients may not be advised to immediately have cessation of drugs or have cessation even in smoking. What is that symptom na lalo silang magti-trigger yung behavior nila, magti-trigger yung physiologic response nila if immediately nag-stop yung patient from dependency or addiction of the drug. It starts with W. You can type it in the chat box. The result of immediate cessation of drugs. Ayan. I really appreciate those who are answering. Yes, correct. Thank you, Miss Redad, and thank you, Miss Nicolas. Your answers, thank you, Joshua. Your answers are correct. Withdrawal. Kaya that's why, ang withdrawal syndrome po ba ay also threatening to the patient? Yes. Kasi they may not be the response of the body is, pag ganun na sila on the addiction or dependent stage na, it's already programmed in the body na physiologically. So that's why there is a process to consider yung rehabilitation. So that's why we need to take into consideration that our nurses will be immersed into rehabilitation of patients who have problems with substance abuse. So we are working on it. We are working on it so that you could really appreciate this role on how it will take part with the Department of Health. So thank you so much for your responses on this. Next, again, as what I have told you, when we talk about the pharmacology, it's very basic to consider the definition. It may not be in verbatim, but anyway, in pharmacology, it came from the root word, or it came from the words pharmakon and logos. Kasi logos, we're talking about the study. And usually we consider this as not just only on knowing how the drug is being used, but the properties of drugs that are being considered by nurses. Example, I just want to set an example. If the patient is experiencing hyperacidity, okay, obviously the problem is increased acid level. So it's already in the stomach. So ang question is that of what drug counteracts acidity? What drug counteract acid? I know you have studied this in chemistry and biochemistry. What is the substance that could definitely counteract with acid? It could be A or B, yan. Your answers could be A or B. What are those substances that counteract acid? Sige, B na lang tayo. B as in boy. Letter, yan. Let us acknowledge those who answer immediately. Miss Mary Manggao, thank you, and Miss April Parcon, thank you so much. Your answer, thank you, Miss Ramos. All of your answers are correct. Base. Okay, now, if you will think of hyperacidity, you will think of drug that is based sa property sa chemical component niya. So maghahanap ka ngayon ng kokontra sa hyperacidity. Ano to? Yung aluminum, may component ng aluminum, may component ng magnesium. Kaya may mga component ng aluminum hydroxide, magnesium hydroxide. These are the drugs. These are drugs that will counteract hyperacidity. Kung nadidinig nyo pa yung mga Kreml S, nadidinig nyo pa yung mga maalox, these are, if you will check yung pinaka-generic niya, may aluminum hydroxide dyan, may magnesium hydroxide. So, ibig sabihin, aluminum and the magnesium is a base drug, ang tawag dyan, anti-hyperacidity drug. So, ibig sabihin, it counteract or rather, other than base, alkaline-based drug. Kasi it counteract the acid. So, doon, it could be easy for us to understand the drugs. Okay? Because with the health condition and health situation, we are now connected how it act to the body. It is considered also as a science. Why? Because we have already considered, di ba, at first that nursing process will always be part of our responsibilities in the pharmacology. So that's why the concept of toxicology is very important. What is now the term that is being used? Why do we need also to know the sources of drug? Kasi alam natin the sources of drug could be from animals, could be from plants, or could be artificially a mix of chemical substances. So that is what we call pharmacognosy. Is the study of the source of the drug. Just like, for example, we have digoxin. Digoxin comes from digitalis plant. There are also drugs that you have heard about, fish oil. So ibig sabihin it comes from the fish. So those are the properties of drugs that are being studied from their sources, and that is what we call the pharmacognosy. And that's why it is called as a science of drugs, because it identifies not just only composition but also the origin and what could be the indication. Okay, if you check also the packaging of drugs, it has indicated their indication and contraindication. So what do you mean by that? The indication is the purpose. Contraindication is not to give those drugs with those conditions. Kasi pag binigay mo yan sa patients with contraindicated diagnosis, again, you're you're giving life-threatening conditions to your patients. Kasi ang ma-experience ng patients mo ay it's either adverse reactions or mag-lead sa serious adverse reactions, toxic effect. Oh, will that be the action of a competent nurse in administering the drug? You are not promoting safety. Next, we're talking about also the properties and reactions of the drug. That's why, since if we are oriented about pharmacotherapeutic, we are oriented on the therapeutic and desired action of the drugs. However, reactions are very important. Drug reactions are very important in a way for us to identify if that is still the physiologic and biochemical reactions of drugs, such as in the pharmacodynamics, or it is already adverse reaction that will need continuous monitoring, or sooner or later, pag nag-lead yan sa toxic effect, it may need already antidotes. So those are important things that we consider in the study of pharmacology. Now, as we continue with our division of pharmacology, we have pharmacokinetics, pharmacodynamics. What are the term that has been added here is number 3, the pharmacogenomics. For every divisions of pharmacology, we entail letter M. So as for us, so that for us to understand easily this concept. But if we say pharmacokinetics, we're talking about movement. So we have discussed this already through the use of the principle of ADME, the absorption, distribution, metabolism, and excretion. So from the time that the drug had been administered, depending on administration site, it could be, for example, the patient could be administered orally, a drug that has been administered orally, and the drug that has been administered through intravenous may have different time frame, because once the patient took it orally, it will still pass through the GI tract until pass to the GUT until liver before it reach pa circulation. Ang purpose kasi of drug that will have lesser time and may reach its peak concentration level ng drug is once the drug already reaches plasma. Kung intravenous siya, direct sa vein, obviously, it will reach already the blood at plasma. Mas mabilis yung pag-reach yung concentration level at mas fast yung time. And this follows through, this applies to the situation of emergency situation and emergency drugs. So pag if it is taken orally, it will take time kasi it will still process by the body pa through the GI until i-detoxify pa yan ng liver. So if we talk about pharmacodynamics, we have discussed this, that this refers to the physiologic and biochemical reactions of the drug. So that's why when we talk about the mechanism, pag nagbasa kayo sa drug handbook, I advise you to have already the drug handbook for you to appreciate as we go on with our discussion throughout the completion of this course. Yung mechanism is we are talking about mechanism of action. Pag if you're already explaining how the drug is taking effect, kasi pag sinabi natin movement, the drug is taken orally, goes to the stomach, intestine, liver, movement lang siya. The movement lang siya until it reach plasma. But if you're talking about how the drug is taking into effect at nagmamanifest siya evidently into signs and symptoms, or either side effect, or either not signs and symptoms but probably moreover with side effect, then that's what we call mechanism. In mechanism also, we need to take into consideration yung tinatawag natin drug interactions. Alam nyo, lalo na sa pharmacotherapeutic, we cannot attain the desired effect kung halimbawa we are facilitating the preparation of the drug that will counteract its effect. Example, there are some drugs who are in pain. Example, patient with alcohol intoxication. Ano yung alcohol intoxication? Di syempre sobrang inom. If the patient have taken too much alcohol, tapos the patient experience injury, and the patient is in pain, hindi agad bibigyan yan ng pain reliever. Kasi the alcohol itself may have the property na mag-pain relief. Somehow, if it's not anymore tolerated by the pain reliever, by the normal reaction of the alcohol sa body, that's the time that the patient will be given the pain reliever. So, yun yung tinatawag natin na hindi agad ibibigay kasi the alcohol itself can already support initially yung pain relief. Another, there are some situations that you are mixing drugs to milk. Ayan, para daw because of the bad taste, because of the problem with the inconvenience of taking the drug. There are some drugs that that may lose the potency or effect of the drug when mixed with milk. Ano pa? Alam natin that the stomach when drug is taken orally, ang stomach ay may hydrochloric acid. Ang hydrochloric acid ang purpose niyan is nagbe-breakdown ng chemical components to be absorbed sa intestine. Pero if you will mix the drug already doon sa highly acidic juices, yung naturally extracted na high acidic juices, ayun, pwede na agad nagkaroon ng premature breakdown of the chemical component, o ano na ngayon yung potency ng drug pag nagpumasok pa at sumama pa siya sa hydrochloric acid. So those are the situations, those are principles that you really need to study. And the responsibility of the nurse is basically one that is being considered when you talk about the principle and the action that must be taken. Next, pharmacogenomics. If we say pharmacogenomics, each one of us, each one of us may have different response to drug. Do you know that drug response may be different from a female and male? To what extent? Hormones, because the difference, the hormones, we may have hormones, but the level of hormones may be different from a male and a female. Magkaiba yon. And that may also counteract action of drugs, or probably that may also have different effects of drug. Example, alam naman natin that contraceptive drugs are taken by female. Pero pag itong contraceptive drugs are taken by male, 'di ba? Nagko-cause siya ng enlargement of the breast. So, ayan, it has a different response ang body natin kasi, and again, it's associated with the level of hormones. Another, in pharmacogenomics, we're considering also yung effect ng drug by familial history. Why do we need to consider and ask the patient if you have history of allergic reaction, if the patient has history of asthma, Kasi alam niyo po, if the patient has history of asthma, it also be associated sa possible effect of drug allergies. And we all know kung ang patient who is having asthma experience allergic reaction, very common din yung reaction that are being experienced sa patient na nag-hypersensitivity or drug allergy. So if the patient may have drug allergies, we will be more careful in administering the drug, or possibly the doctor may change the drug if it has identified allergic reaction to certain drugs. Kasi we will take the risk. If we will take the risk for the patient to take the drug, then that could possibly lead to possible complications sa pasyente. And that is negligence on the part of the nurse because you have not performed your basic responsibility on health assessment. Next, number 4, pharmacotherapeutic, letter M. We've considered the pharmacotherapeutic as its desired effect and if the drug reaches its maximum effect. Okay? So next, as what I have mentioned to you, uh, before we have our health break, we'll have our self-assessment exercise on the first phase of our topic. Hoping the 36, okay ha, 36. We can monitor your responses. Hoping majority and all of you will have those responses in those questions so that we could rationalize. Just consider this as questions that may appear in the licensure examination. And this could be one way for you to test yourselves if how you will answer those questions. And these questions have been retrieved to previous licensure examinations, local and foreign, hoping everyone will participate. So your answers can be typed in the chat box, and I will expect the majority of the students here will definitely participate. Okay, let's have the first question. The first question, the nurse who is caring for a client explains the movement of drugs into, through, and out of the body. So these are the choices. We have, is it pharmacokinetics? Is it pharmacodynamics? Is it pharmacognosy or pharmacotherapeutics? Type in your answers in the chat box. So we have already 7 answers. So we can monitor if the majority are responding, and we could identify if our students here are very attentive in our discussion. So this could be one way of my evaluation if you are really learning from our discussion. So out of 36, we have 25. So meaning there's still more who need to answer these questions. So when you just continue to answer, when you encounter questions in licensure examination, since you have been oriented of some of the key terms, you may consider po key terms that it will identify. If you've seen already the choices, what the key terms that you can use as your guide for you to have the correct answer. So the nurse who is caring for a client explains the movement of drugs. So I'll check your responses. Okay? So majority, almost all of the responses out of the 26. Okay, it had 27 responses out of 36. So we still have 10 who missed to respond in our questions. So hoping you can still post your answers, ha? So ayan, nadagdagan tayo. So naging ano na siya, naging 30. Okay. So the 6 are still missing in the class. Anyway, I want to hear your voices. Even though you are muted, I want to hear your voices through your answers in the chat box. But anyway, so very obviously in the question, ayan, nadagdagan na. Very obviously, the nurse who is caring for a client explains the movement of drugs. Actually, the one term that really identified here, that is really identified here for you to have the answer is movement, right? And that movement, hoping you have those answers correct. Let's have the answer. The answer is letter A. Okay? Pharmacokinetics. Why? Because we've considered the term movement. Yes, sir. It's not indicated there the absorption, distribution, metabolism, and excretion. But again, let us use the analytical and critical thinking. Not at all times we could be in verbatim in analyzing the questions. Ha? So that is referring to even into, through, and out of the body is referring to the ADME. Into, absorption and distribution. Through is metabolism. Out of the body is referring to excretion. Again, the pharmacodynamics is referring to the physiologic changes and biochemical reactions of the drug. Pharmacognosy is referring to the study of the sources of the drug, and pharmacotherapeutics are referring to the maximum effect of the drugs or the desired effect of the drug. So let us continue hoping to have more responses, or almost all of the 36 may have those responses. Next question. The pharmacokinetics can be simply described as the study of what the body does to the drug, except, meaning if you encounter these questions in the licensure examination, we are looking at the statement that will not describe pharmacokinetics. Okay, so let us now show the choices. The choices are, we have A, at the rate and extent to which drugs are absorbed into the body and distributed to the tissues. B, the rate and pathways by which drugs are eliminated from the body by metabolism and excretion. Letter C, the relationship between the time and plasma drug concentration. And letter D, the drug produces biochemical and physiologic changes in the body. You can now type in your responses and answers in the chat box. What we're looking at is except, meaning statements that may not describe pharmacokinetics. From the discussion that we have a while ago, we have already defined and used those terms that could be associated with pharmacokinetics. Okay, so we appreciate that we already have 18 responses. Okay, so we need more responses so that we could evaluate if you are having your commitment to pass the nurse licensure examination. Because again, as what I mentioned, this has been retrieved from the references of licensure exam. So we have 29 out of 36. So let us wait for the others. While you are having your responses to be posted in our chat box, if you will observe letter A, we're looking for except letter A, the rate and extent to which drugs are absorbed and distributed to the body. You have been aware of ADME, right? So ibig sabihin, absorption and distribution are definitely considered. Kasi this is part of the pharmacokinetics as ADME. So this statement is correct, but mainly what we're looking at is the incorrect statement. So we have letter B, letter C, or letter D. But I will check first your responses. Okay? Ayan. So mukhang majority ang answer ay letter D. Tignan natin kung if your answers are correct. Okay? Majority of your answers are letter D. So let us have the analysis. On letter B, the rate and pathways by which drugs are eliminated by the body or from the body by metabolism and excretion. Again, ADME, metabolism and excretion is the part of the stages of pharmacokinetics. So probably letter B is correct. So we have only letter C or letter D. Remember, we have also discussed as an example that I have, when the drug is taken into the body, it may also be dependent on the time, right? In that the drug has been taken orally, it will take time as it is absorbed by the body compared to a drug that has been given intravenous, because the drug is directly reaching the plasma already. The shorter time, the peak concentration level, it's because of the drug already reaches the plasma. So do you think letter C is correct? Let's see letter D. Letter D, the drug produces biochemical and physiologic changes in the body. If we are talking about biochemical and physiologic changes in the body, we are already talking about reactions of the drug. And this has been already another phase that possibly be considered other than the ADME. So let us see if your answers are correct. Your answer, letter D. Okay, so majority of you have answered letter D because letter D, we're talking about pharmacodynamics. Let us next question. Next question. The nurse is aware that the maximum use of drug to treat a specific disease or produce a desired effect. Is it pharmacokinetics, pharmacodynamics, pharmacogenomics, or pharmacotherapeutics? Remember, let's go back again. You have seen already the choices. You have seen the questions. What are those key terms that will facilitate correct answers in this self-assessment exercise? So we have okay, Max. Okay, let's wait for the answers. Baka ma-preempt ko for those who are waiting for the clues. Okay, we have already 22, 23. Okay, let's see. Let's see. Okay, remember ha. Remember, you need to answer on your own. You need to answer on your own and be firm on your own. If you are being pressured because they have the same answers, it's not always the thing. It's not always the mechanism that we're talking about. So if their answers or you are being pressured kasi you will have different answer. Remember ha, when you answer licensure examination, you will think alone and you will analyze and use analytical and critical thinking alone when you encounter these questions. So let's see. So majority of the answers. So what are those terms? Most of your answers are letter D. Let's see. The key terms that could be identified in the questions are maximum, treat, desired effect. So meaning if we are directing on this perspective, I may not anymore take time to reveal the answers. So the answer is pharmacotherapeutics. From the three questions, hoping for those perfect three who have already correct answers, you're gearing towards the RN. Okay. 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 That's what we call confidence. Next question. Next question is, we have the nurse noted a harmful unintended reaction of the drug, which refers to the following. Okay, so the nurse noted the harmful unintended reaction of the drug, which refers to A, desired effect, letter B, toxic effect, and letter D, side effect. The nurse noted a harmful unintended reaction of the drug, which refers to A, desired effect, letter B, adverse effect, letter C, toxic effect, or letter D, side effect. So we have already 21 responses on the loop, 22, 23, 26, 26, answer 26. So how about the others? We are 36, 28. So hoping majority or all of you will respond to this question. Remember ha, go back to the question. The nurse noted a harmful, unintended. Okay, let's eliminate ha. This is another process of how you will have correct answers. Remember class, if you consider harmful, will you still answer letter A or letter D? Naku, tingnan nga natin if we have answers of letter A or letter D. Okay. Eto ha, ganito po yon. Noted a harmful. Kasi kung for example, letter A or letter D ang sagot ninyo, kasi di ba if we say desired effect, therapeutic. If we say side effect, it's the normal physiologic and biochemical response of the drug. So pag sinabi nating harmful, that's really not our intention. Okay? So the answer is probably letter B or letter C. So if it is untoward or harmful, that is something that we need as a nurse to monitor so that it may not lead to a higher level of dangerous and life-threatening condition. Okay? So all answers are in the chat box. Let's see. Don't be disappointed if you have not taken the correct answer. This is again a learning session, a venue for us to learn. Okay? So that if you will encounter these questions, you are now aware. Okay, next, the answer is adverse effect. For those who answer letter B, congratulations. Next, we have next question. The nurse notifies the physician due to a serious adverse effect that occurs when plasma concentration of the drug reaches dangerous or life-threatening level. So what are those choices? Choices are side effect, adverse effect, toxic effect, desired effect. Okay. Process of elimination tayo ha. Serious adverse effect na ito. Dangerous, life-threatening. So obviously, you will not answer letter A or letter D ha. Kasi side effect, it's not on the point of dangerous and life-threatening, even the side effect. We do not aim for a drug that is intended for the desired effect ha. Okay, not is light and dangerous. Okay. So we have 27 responses. 27 responses. Uh-huh. Where are the other 9? Okay, the other 9. So hoping the other 9 can still follow through with your responses. But anyway, so you could have only letter B or letter C. Remember, uh, in letter B, if you will answer adverse effect, but in the question, it already identified serious adverse effect. So it may not anymore consider the adverse effect again as an answer, since because it uses already serious. So the answer, hoping everyone, let's see the answers. Okay. The answer is toxic effect. Okay. Toxic effect because it's already a higher level of adverse reaction that could be life threatening. Next question. The nurse emphasizes in her health teachings the reduction of effectiveness of medication in treating a disease or condition. I set an example for this. Is it letter A, drug tolerance? Letter B, drug resistance? Letter C, drug dependence? Or letter D, drug abuse? The nurse emphasizes in her health teachings on the reduction of effectiveness of medication in treating a disease or condition that refers to A, drug tolerance, letter B, drug resistance, letter C, drug dependence, letter D, drug abuse. We're talking about reduction of effectiveness. Reduction of effectiveness. That is already the term. That is already the clue that you may consider in the question. Okay? So I'll just check those responses. Okay? So let's see. Yeah. I think majority of you have those responses of letter B. Okay ha? If we have those answers, panindigan natin ha. Even though kung mali man yung sagot, it's a learning experience. So again, if your answer is letter A, drug tolerance, pag sinabi natin drug tolerance, this is what I am emphasizing to all of you. Each one of us may have different response to the body. It's either, for example, a patient, an individual, you can tolerate non-pharmacological, that's very good. But if the patient cannot anymore tolerate non-pharmacological, the patient may have a drug that is basically to treat the patient. So that dun kasi na nato-tolerate yung relief of pain, for example. Pero may mga situations din na even though the patient is taking the drug, the problem is that mas higher dose pa yung uh, maiko-consider na mato-tolerate. Pero the same effect. Kasi kung for example, 500 milligrams, 100 milligrams may have the same effect to everyone. Pero sa kanya, yung 1 gram is the same effect with 500 milligrams. Kaya even higher dose, pero the same effect of pain relief. So ang tawag na doon ay meron tayong tinatawag na drug tolerance. Nagiging dependent na siya kung halimbawang always 1 gram na. Yun na 1 gram. At kung for example, ang patient is not in pain, pero still taking the drug, ay, drug abuse na yon. So now, the answer is definitely on drug. As my example, di ba, antibacterial resistance. So the answer is drug resistance. Next question. Next question, the nurse assists the client after taking the medication on the expected physiologic response that is unrelated to the desired action of the drug. Okay, ha? Okay, the nurse assists the client after taking the medication on the expected physiologic response that is unrelated to the desired action of the drug. So hoping you have your responses already posted in the chat box. Okay, let's see. So because you are already guided with those questions, so let's wait for the others to respond. So we have a maximum of the responses of 28. So I'm looking for the others who are not responding as well. So we still have 6 plus 2, 8 students who are not responding with questions. So I think majority of you have posted those answers. All of you have, actually all of you have answered letter C. So let's see if your answer is correct. Answer is correct. Why? Sir, don't be confused. Kasi sir, may nakalagay expected pero kinontra siya ng unrelated to the desired action. Ganito 'yon, 'di ba sabi ko nga sa inyo. Ang expected physiologic response ang expected intention or indication is antihypertensive. Pero hindi ine-expect ng patient natin na the patient experiences headache. So as it goes with the process of action of the drug, may mga unrelated na desired action na i-explain mo that it's unexpected physiologic response. Kung unexpected na siya, unintended, doon na siya papasok sa adverse reaction. So that is what we call side effect. Next question. Actually, these questions may be expected. It will really test your comprehension kasi ang haba niya. Pero somehow, one thing that will really guide you is basically to retrieve those key terms. Okay? So, the nurse understands that the ability when the client endure ordinarily injurious amounts of drug or the lowering of the effect of the drug obtained from established dose requires raising of dose to possibly toxic effect pero toxic level to maintain the same effect. This is what I told you a while ago. So the patient, we may have different responses to drug. So will it be drug reaction? Will it be drug dependence? Will it be drug effect? Will it be drug tolerance? Again, which of the following could be considered? The nurse understands that the ability when the client endure ordinarily injurious amounts of drug or the lowering of the effect of the drug. Kasi again, sinabi natin sa pharmacogenomics, di ba, that individuals may have different response to drug. Patient, but hoping I may not mention the term because you will be guided in the choices. Each one of us may have different adaptation. Yan, different adaptation with the response of the drug. Okay, so we have 25, 26 responses, 26, 27, consistent, the 8, the 8, where are you? Who are not responding to our questions. So, okay, but anyway, I will not take this long. If we say drug reaction, it is definitely either we are referring to the physiologic and the referring to either side effect or adverse reaction. Again, drug dependence, we're talking about the client is already relying on drugs. And drug effect is if we are talking about reactions or if we are talking about desired of effects. So it's not clear, that may not match to the question. Or letter D is the answer. Let's see, what is the answer? The answer is drug tolerance. Ito yung minention ko sa inyo, that there is some situation that it raise the dose kasi the patient cannot manage yung certain level na yon until masyado nang mataas yung dose kasi yun yung natotolerate ng pasyente. That's why dito pumapasok yung principle of placebo. I hope probably you may encounter this in your health ethics na ang placebo binibigay, these are administered to the patient but not technically the drug itself is being administered. Pwedeng ang ina-administer diyan ay saline solution because the patient is already dependent to the drug. Kaya and somehow kasi 'di ba the drugs may cause its effect to other organs of the body. So it is given to the patient to psychologically prepare the patient and think that the patient is taking the drug. Pero on the other hand, meron din siyang ethical consideration kasi you're administering the drug and you're not telling the truth to the patient what you're administering. So those are dilemmas pa rin in ethics. Next question. The nurse observed the client on the physical and psychological reliance on chemical agent resulting from continued use, abuse, or addiction. So will it be therapeutic effect? Will it be drug dependence? Will it be drug interaction? Or will it be the desired effect? Eka ha, let us think of this matter. Aba, dumami yung responses natin. Okay, but anyway, that's good. That's a very good sign. Kasi remember, class, for those who will answer letter A and letter D, remember, ito yung composition of the statement that if it is continued use, it will cause abuse or addiction. Hindi na siya desired effect tsaka therapeutic effect. So so probably you will mislead if your answers are letter A or letter D. So letter B or letter C could be your choice. Okay, so we have 26 responses. Again, where are the other 8? You're still missing on the loop. So anyway, the only possible answers could be letter B or letter C. So if it were talking about letter B or letter C, let's see, let's check. Kasi kung drug interaction ang answer ninyo, these are the drugs that will, ayan, these are the drugs that may possibly counteract potencies and effect of drugs, di ba? Ano yung sabi ko sa inyo pag sinabi natin drug interaction? If the drug is mixed with other drug, pwedeng mag-lose yung potency ng isang drug. Second, if the drug is mixed with highly acidic juices, pwedeng mag-cause ng premature breakdown of drug. Third, pwedeng the drug could be mixed with milk na pwedeng mag-cause ng na mag-lose ng potency ng drug and may not cause its expected desired effect. Yun yung drug interaction. So, very obvious na sir ang sagot. Tingnan natin. I think most of you have answered in response on letter B. So let's see if that's the answer. The answer is drug dependence. Okay. So I think we ended up, I extended the time that's supposedly 9:30 that will have the break. So since I have extended, I will extend also your health break up to 30 minutes because I owe you with the extended time of 15 minutes. So probably stay there, stay put, hydrate yourself, stretch your extremities for you to regain your circulation, and we will be back after 15 to 20 minutes. So we'll continue. So it's almost 10:50, 10:55. So we will resume at 10:20 if that will be okay with you. So we'll be back, hoping you will stay put and will let us continue our learning journey in pharmacology. Thank you very much for your cooperation and active response. So let's pause for a while. So it's almost 10:20. So we'll continue with our discussion. Okay. So hoping everyone have already attended to your basic physiologic needs and have regained the expected energy for you to absorb what we have learned for the past topic that we have. Now, to continue, let us continue with the pharmacokinetics. I will be showing to you an audiovisual presentation that will explain initially about what pharmacokinetics is, how the absorption, distribution, metabolism, and excretion happened on the pharmacokinetics. Let's watch.
Hi, this tutorial is the first in the pharmacokinetics series. So first of all, I should talk about what pharmacokinetics is. Within pharmacology, we often talk about two distinct, but unfortunately unintuitively named branches. These are pharmacokinetics and pharmacodynamics. Briefly, pharmacodynamics is the study of the effects of drugs on the body. That is, what does this drug do to the body? What receptors does it activate? And what other effects does it have? Alternatively, pharmacokinetics is the study of the effect the body has on drugs. In pharmacokinetics, we ask questions like, how does the drug get into the body and where does it go? What does the body do to the drug? And how does the body get rid of the drug? It is this branch of pharmacology that we will be looking at in this series. So let's begin with a pharmacokinetics acronym you'll find in every textbook of pharmacology. ADME. A-D-M-E. This stands for absorption, which is how the drug gets into the body. Distribution, which is where the drug goes to in the body. Metabolism, which is how the body chemically modifies the drug. And finally, excretion, which is how the body gets rid of the drug. These are four elements we need to consider when talking about the pharmacokinetics of a certain drug. The following tutorials will each talk about a certain aspect of pharmacokinetics. But for the remainder of this tutorial, we are going to discuss some of the more boring but incredibly important aspects of pharmacokinetics and pharmacology. So I'll begin by drawing a graph. And here on the y-axis, we have the concentration of drug within the body. And on the x-axis, we have time. So if we give a person a drug at time 0, then we will see the concentration of the drug go up, and then it will fall slowly as the drug is removed from the body. And that's what we see on this graph. So looking at this graph, we can see that in this section, the drug enters the body faster than it is being removed from it. Therefore, the concentration of the drug in the body increases. Then, after the peak of this graph, the drug is being removed from the body faster than it is entering. So the concentration of the drug in the body starts decreasing. This point at the top of the graph is important because it is the highest concentration of drug in the body. Therefore, we call this the maximum concentration, or Cmax. This is important because knowing the maximum concentration can help predict the therapeutic benefit and also the likelihood of side effects. The time at which the maximum concentration occurs is called Tmax. Now, a slightly more confusing concept is the half-life of a drug.
Okay, if I just need to go back. Okay. In particular with the okay, let's have okay. So while we are preparing for the again the video, I just want to supplement some of the explanation that was made in the video presentation. So but I need to restart. Okay, just stop. So I'll just need to restart the video. So for a while. Just need to